31. Left coronary artery, 29. Marginal branch artery, 63. Circumflex branch artery, 49. Anterior interventricular, 50. 61. Posterior interventricular artery. Good? Okay. Veins. There's 4 veins we're going to learn. Arteries came in pairs. Veins are going to come in size order. The first one here on the front, this is the great cardiac vein. You see there's no number. The great cardiac vein comes up, it goes around, and it goes into right here, number 28. On the exam, they're not going to ask it to you over here. They're going to ask you the vein up here. They're going to ask name the vessel blue. That's why you don't memorize the numbers. You gotta be careful. Same thing, circumflex branch artery, they're not going to ask you 49. They're going to ask it up here in the front. There's no number, right? Great cardiac vein, blue. On the posterior, number 60, here's the middle cardiac vein. Great cardiac vein, middle cardiac vein, number 60. And underneath the marginal branch, we have this vein that comes down and around, 46. This is the small cardiac vein. Great cardiac vein, middle cardiac vein, small cardiac vein. All the veins collect into this enlargement underneath the hole where the stand goes into, right? That enlargement is called the coronary sinus, which, as we know, has an opening in the right atrium, number 58. 27 on the outside, the enlargement is called the coronary sinus. 58 on the inside is the opening of the coronary sinus. And that's how blood re-enters the heart to go through the pulmonary circuit. Questions with that? Good? If you have this, sulcuses. There's 2 sulcuses you should know, or you probably have to know, maybe 1. Sulcuses are the spaces where the arteries sit inside of. So imagine I were to pull out this vessel, there would be a groove. Like there would already be a set space of adipose tissue and like myocardium. Like it would be a set groove where the vessels go into. Sometimes you have 2 vessels in that same groove. These are called sulcuses. The sulcuses we know, or we have to learn, are always going to be named after the artery that's located inside of them. Here is the right coronary artery. So the space here would be called the right coronary sulcus. Here is the anterior interventricular artery. So the space here is called the anterior interventricular sulcus. The way they ask that, technically there is a number 3 and number 5, I think, but they don't really ask you like that. They will just point here and they'll ask you name the vessel, red. Vessel, right coronary artery. Name the space, right coronary sulcus. Does that make sense? Mm-hmm. This was a little harder. They ask you name the vessel, red, anterior interventricular artery. Name the vessel, blue, great cardiac vein. Name the space, anterior interventricular sulcus. Does that make sense? Any questions with that? Good? Okay, good. Last section. All right, so you can stop your videos and just restart your video.